UK plastic surgeons are calling for a ban on breast filler. So in the UK, they're having a similar problem to what we have here in the United States, where poorly trained personnel are injecting this, that, and everything into breasts for a DIY or a non-surgical breast augmentation. So let's talk about why this is a bad idea and why the UK surgeons are coming in strong against it. So the breast is obviously a unique area in a woman's body, and the chance of developing breast cancer in your lifetime is relatively high. It's one of the more common cancers that women face. The reason why we are so successful with treating breast cancer is that we're really good at catching them early, and catching them early means getting your breast screening, which is a mammogram. Now, anytime we do something to the breast, we run the risk of creating something that shows up on mammogram that either masquerades as a cancer or hides a cancer, which is even scarier. Now, the breast is also a unique area to inject and operate on because there's a natural microbiome of the tissue. The tissue itself, as you cut through, is not sterile. The ductal system is open through the nipple, and so there's bacteria in it. So when you're injecting something throughout the breast, you're doing surgery on the breast, you have a decently high risk of exposing whatever you're using to bacteria. And this can lead to all sorts of problems. Infection, in particular, abscesses, is a huge concern. Infections lead to inflammation, scarring, which can mask tumors on mammography. If filler is injected into the breast, in addition to potentially having an abscess or masking a breast cancer, it can migrate, it can encapsulate, it can be painful, it can be very problematic. And removal can be deforming, just like the actual lumps of filler can be. The main issue with these non-surgical breast augmentations is that a majority of the people doing them aren't surgeons. They're people in med spas who are not properly trained, don't understand breast anatomy, and certainly can't manage the complications. So I always understand the appeal of something that's non-surgical or minimally invasive, but in this situation, not only is it not safe because it hasn't been studied, it's being done by people who have no business doing a procedure in the breast. So I absolutely agree with UK plastic surgeons. I hate this trend of injecting things in the breast that don't belong there. As someone who treats cancer patients, that always needs to be at the back of your mind when you're operating on a breast.